Okay, we're going to be starting lymphatic disorders. And in this lecture, we'll compare and contrast Hodgkin's and non-Hodgkin lymphoma based on some of the pathophysiology, the manifestations, diagnosis, and treatment. And we'll talk about multiple myeloma. And then we'll also talk about lymphedema and what can happen if you obstruct the flow of the lymph or lymphatic circulation. So let's start with lymphoma first. Okay, so lymphomas, they are a diverse group of neoplasms that develop from the proliferation of malignant lymphocyte proliferation in the lymphatic system. Okay, just straightforward basic definition: malignant lymphomas, proliferation in the lymphatic system. These are lymphomas. There's a high risk in adults who receive radiation during childhood. And the two major disorders that we are going to speak about, and you need to be able to differentiate, are going to be the Hodgkin's lymphoma versus the non-Hodgkin's lymphoma. The non-Hodgkin's lymphoma is distinguished by multiple lymph node involvement. They're non-organized and they're widespread with metastasis. That's pretty important stuff right there. So HL or Hodgkin's lymphoma, this is characterized by the progression of lymphoma from one group of lymph nodes to another. The development of systemic symptoms and the presence of Reed-Sternberg cells. These are giant cells that are present in lymph nodes. So that's an important feature to understand. Reed-Sternberg cells represent the malignant transformation of lymph cells. So the development of systemic symptoms and the presence of Reed-Sternberg cells, these are giant cells that are present in lymph nodes. That is a key with Hodgkin's lymphoma. They initially involve a single lymph node, primarily up in the cervical region. There are lymph nodes in front of the SCM muscle. They are located behind the SCM muscle, in front of the ear, behind the ear, under the occiput. They're all over the cervical spine. Later, the cancer can spread to adjacent nodes and then other organs through the lymphatics, but typically involving one single lymph node. That is the Hodgkin's lymphoma. There isn't much known about the triggering mechanisms. They think that it may be linked to the Epstein-Barr virus infection. Slightly more prevalent in males over females, and the two different peak ages are between 20 and 30 and 60 to 70. So one of the first indicators is usually a painless enlarged lymph node. And this is something that I pick up regularly in the office, and it's something that we monitor because sometimes I can palpate a cervical spine, I can palpate the musculature around the neck, and sometimes we feel lymph nodes. And lymph nodes, or the lymph chain, can be swollen because there is an active infection, and within 7 to 10 days, it's back to normal. So making a diagnosis or an assessment based on one visit, it's not good for anyone. So I typically tell my patients we're going to do a treatment and then we will reassess them after 10 days. Now, after the 10 days, usually the lymph nodes have gone down in size or we can't palpate them at all. If it's chronic and now we can feel it after 10 days, and then it's after 3 weeks or 4 weeks, despite any given treatment and recommendations, then that's when we go for further investigation. Okay. Later, it can lead to an enlarged spleen and enlarged lymph nodes other than the cervical. It can go into the armpit, the axillary. It can go into the groin, the inguinal lymph nodes. It can go retroperitoneal as well. Some of the general signs of cancer, this is weight loss, anemia, low-grade fever, night sweats. Remember the unexplained weight loss when someone's losing weight and they're not trying? That is a key feature. Also, low-grade fever. Nothing super high, but it's low-grade, but they often get the night sweats. That is a general sign. And the treatment is typically radiation, chemo, or surgery. Here is one swollen lymph node right here. Here again, swollen lymph node off the cervical spine here. Okay. Now let's look at where some of the other lymph nodes can be. So in the pink is the common sites, and in the blue, the uncommon sites. So let's look at some of the common sites first. So we look at the cervical lymph nodes here. They're called supraclavicular because they are above the clavicle. In the armpit, axillary. Retroperitoneal means they're located behind the peritoneum. Inguinal. And then we can go to the uncommon, you know where the trochlear is of the elbow. So there's epitrochlear and brachial lymph nodes. They can actually go here near the biceps brachii as well. So you have epitrochlear and brachial would be up in this region. There are mesenteric lymph nodes, and near the knee, popliteal lymph nodes as well. So in stage 1, there's a single lymph node that's involved. We could see it here. And then in stage 2, we have multiple regions on the same side of the diaphragm. So here is the diaphragm, and these are all above the diaphragm. That's what they mean by same side. Stage 3, lymph nodes on both sides of the diaphragm. So here's the diaphragm. We have axillary. We have some here in the cervical. We have some here in the umbilical. We have inguinal. And then we have stage 4, which is widespread, which involves above the diaphragm, below the diaphragm, and then it hits the spleen and the liver, where you have splenomegalia and hepatomegalia as well. Non-Hodgkin's lymphoma, this is increasing in incidence. And one of the reasons that it's increasing, it's partially caused by an HIV infection. And the differences from Hodgkin's lymphoma to non-Hodgkin's, well, 80% of the cases involve B lymphocytes. Multiple node involvement scattered throughout the body, non-organized pattern of widespread metastasis, right? So when you have particularly one lymph node involved, we're thinking it's Hodgkin's. When you got multiple node involved and they're scattered throughout the body and they're not organized in pattern and it's widespread metastasis, we're thinking non-Hodgkin's lymphoma. Similarities, the clinical signs and symptoms are similar to those of Hodgkin's disease. The initial manifestation is enlarged, painless lymph node. And it's just more difficult to treat when the tumors are not localized. The multiple myeloma, let me go back here for a second. So this brings the close to the non-Hodgkin's lymphoma. The multiple myeloma, this is a type of cancer or neoplastic disease of the plasma. Okay, so multiple myeloma is also called plasma cell myeloma. This is a neoplastic disease that involves increased production of plasma cells in the bone marrow. Unknown cause, it occurs in older adults. The production of other blood cells become impaired, but there's multiple tumors in the bone. And this is a loss of bone. It just looks like many punched out holes that you could see throughout the skull. That's what it ends up looking like Swiss cheese, many punched out holes. severe bone pain. Prognosis for this is very poor. Um, it's a short life expectancy, unfortunately, with multiple myeloma. And the onset is usually insidious. And the malignancy is well advanced before the diagnosis is even made. The pain is caused by the bone involvement, typically the back, the hips, the rib. It can be present in the femoral neck and the vertebrae. There's anemia and bleeding that's often seen with this. There's impaired kidney function that eventually leads to kidney failure. And the x-ray reveals these lytic lesions, especially in the axial skeleton, so in the skull, in the vertebrae, and these lytic lesions just look like Swiss cheese, just very many punched out holes that look like you took a hole puncher and punched it through this. We see it here as well. This is in the ulna, the ulna and the radius and the humerus, all these punched out radiolucent circles, multiple myeloma. Treatment has to be chemotherapy to try and encourage the remission, but again, as we said, the prognosis is poor with short life expectancy. The outlook has been improving lately with the survival rate of 7 years. Lymphedema. Lymphedema is when you have this incredible amount of swelling that you can see in the extremities due to some sort of obstruction in the lymphatic vessels or in the lymph nodes. And there is primary lymphedema and secondary. So primary is the congenital form, and the secondary is due to an inflammatory or mechanical obstruction from trauma, a regional lymph node resection, like from some surgery, irradiation, or filariasis, which is a type of parasite. But the extremities swell because of the lymphatic and lymph accumulation. The treatment is typically diuretics, bed rest. Massage is extremely, extremely beneficial. There is a type of treatment called lymphatic massage. It's very important that the licensed massage therapist is trained in this and knows the direction to manipulate the soft tissue to push the lymph towards the drainage vessels. Elevation of the affected extremity is important, and surgical procedures may be needed to drain the lymphatics. There is elephantiasis, which is also referred to as filariasis. This is caused by a blockage because of a parasitic infection called filaria. Rarely can it be caused by chemical irritation from the ash of volcano, and that is seen in Africa. There is significant swelling to the affected extremity. There can be swelling of the lower leg, the breast, the genitalia. There's thickening of the skin and the subcutaneous tissue, often frequent infections. The skin can ulcerate from being overly stretched. Because of these infections and ulcers, fever is typically seen. Treatment is usually medication and some sort of cocktail that's required to kill the parasite. And you can see here's the normal size of the leg, and this is what lymphedema looks like. You can see there's some ulcers, intense swelling, there's probably cracking, this will eventually ulcer, and infections and fever can be seen with this. It can happen of the upper extremity and lower extremity both.